everybody. Happy Twin Tuesday.
Tuesday.
Woo woo. Dr. Johanna.
Dr. Madeline.
We're your awesome chiropractors at Atlas Chiropractic Center located in
Sunny St. Petersburg, Florida.
Yeah, where we see your whole family, but
We specialize with our pregnant postpartum mamas.
heck yeah, you're our jam. But we love your whole entire family.
All of y'all.
So as you're jumping on, make sure you are saying hello.
Drop some love, some emojis down. If you're hopping on the replay, say replay down below to make sure we don't miss you as well. We appreciate all of y'all and grateful for everyone who's tuning in.
Yeah, absolutely. So today we're talking about something that we hear all the time in practice, and I think it's very important to touch on because we have some answers for you.
So I would say every so often, or more often than not, we have people who end up in our office and their story is kind of similar. I kind of woke up in pain, I have pain, it's like taking me out of my life, it's really annoying, I can't figure out what to do about the pain or how to fix it. I went to my other doctors, they didn't give me any answers.
They took an x-ray, they said everything's fine, because we're going to touch base on that.
Imaging, everything's fine, everything's normal, don't worry about it. Maybe give you some shot options, some anti-inflammatory options, and probably sent you on your way. Maybe some muscle relaxers.
Maybe it worked, maybe it did not, maybe it worked for part-time and it came back. Either way, you're in our office for a reason, so there's still pain and discomfort there, right? So let's kind of break it down. So first, I'll talk about the imaging real quick. So the thing that your medical doctor looks for when they're looking at x-rays or something like that is they are looking to make sure nothing is broken, nothing is torn, there's no cancer or anything crazy going on, which is great. Because we want to make sure those things are not the cause of what's causing your pain and discomfort. With an MRI, same thing. They're making sure there's no tear in the muscle, ligament, and tendon, making sure that the disc is healthy, there's no compromise with that. Again, good, because we need to know that stuff is going on. But when we look at x-rays, we analyze it extremely different than a medical doctor, because we're going to check for that stuff too. But in addition, we're going to check your alignment, we're going to check your posture, and we're going to check to see if there is any functional misalignment going on that can be leading to the pain and discomfort that you feel. And that's just done by the additional training that we have as chiropractors. Just check each individual joint. We have additional x-ray analysis program in our office to be able to do so, and that allows us to find the root cause a lot of times to what could be causing that pain and addressing it from a conservative chiropractic standpoint, which can help decrease inflammation, decrease pain, increase healing, and allow for your body to start to feel and function better.
Yep.
So we're looking for different things. So it's okay if your medical doctor doesn't see something and say, we don't know what's wrong. And it's okay if your chiropractor says, we do, this is what we see, because we're analyzing it in different ways.
100%. And I would say, like, what it boils down to is it's a joint problem. Like, most of the time, I'm not saying all the time, and this isn't medical advice for you in particular because we have not done an exam on you and we're not your doctors, but a lot of times in these scenarios we find that it's a joint problem. And remember, joints there's bones that make them up, there's soft tissue around them, so we have muscles, we have ligaments, we have tendons, we have discs that sit between the spine and our vertebrae, our shock absorbers. So all of these things are aggravated or inflamed, and maybe it's not at a level that we do an MRI and we see the disc is bulging or herniated, but it's at a level that other imaging says everything's normal, and maybe your primary care looks at it and it's like, well, it's normal, you just have inflammation, and we still get people coming in like, well, why is this happening? I need an answer. Our answer is, it's a joint problem.
It's a joint problem, and joints are made to move, and that is one thing that other doctors don't possibly evaluate and look at, and that's one thing that chiropractors do. So we're making sure the joints are properly moving. A lot of times they're not, which is why there's pain and discomfort there, and that's what we focus on, right? We focus on the joints, the spine, and the nerves that come out from that area.
And everybody has a different healing process, so I think it's important to throw in there right now, because everyone does heal differently depending on multiple different factors. So some people are going to get out of pain in one adjustment, which just doesn't mean that the issue is gone. There's still stuff to work on. But other people take quite a few adjustments and repetition to really get out of that pain cycle and to change that. So it depends fully on like what's going on in your life, how long the injury's been there, what's been going on, what other things you're doing. So we have to check in with some of those things as well. So we ask all of y'all that, and we help with that when you were in the office.
Yeah.
Dakota says, hey.
Yes. So don't worry if that is going on and it just is taking a while to heal. I don't know if you touched on this yet, But if it takes a while to heal, it's because it takes time and repetition to heal all injuries that occur. And so that sometimes you can adjust it and feel a little bit better, but the pain can return. It takes time.
Especially, remember we said joint has bone, it has muscles, it has ligaments, tendons, so the soft tissue takes a lot longer to heal than other parts. So give yourself grace in that healing process. Know what you eat affects it, what you drink affects it, your stress level, your sleep, how you're sitting for work, what your exercises you're doing, like all these different things affect your healing process. So keep that in mind as well as we are working on that.
Yep, absolutely. So don't fret. We understand. We know what's going on. We're able to help you. And we just like to send this video out because sometimes it's important to remember those things because there's a lot going on. And if we could, if it was as easy as that, then everyone would be in a chiropractic office. So it takes time and repetition. We will get you there. So don't fret, right?
Yeah, that's it. It's a joint problem more than likely. We're really good at working on that in our office. Sometimes you do have to give it time, but maybe that's why your other doctors looked at your imaging or other things and said everything was normal and nothing to worry about, but we don't know why you're in pain. So,
yeah. And Dakota says he agrees.
Yeah.
And have a happy Halloween.
Oh yeah, enjoy.
Yes. We will see you next week.